Hello, everyone. You are live with Jonathan Maness, aka the One-Leg Bandit. And I am so excited today, like every day, but today is a major day for Maness Veteran Medical. When you talk about changing the world and changing people's lives, when I started Maness Veteran Medical, I wanted to ensure that all of my fellow veterans at the VA had access to the most game-changing, life-saving products that were out there. And I was fortunate enough, blessed enough to become a partner of MolecuLight. And I have people here with me today from MolecuLight, Mr. Mike Gleason and Ashley Jacob. And they're going to be doing a demonstration, talking with me today about MolecuLight. And I'm just so excited to share this with you. What I need you to do is go to Jonathan Maness at YouTube and subscribe to that channel, and also follow me here on LinkedIn so we can spread this word to everyone, because my main goal is getting this out to every VA in the country so everybody has access to this technology. But right now, no further delay, I'm going to go ahead and bring in Ashley and Mike.
Hi,
Hello.
Jonathan.
Hey, how are y'all making it today?
Good.
Great.
Jonathan, thanks for having us. How are you?
Doing great. And I was letting everyone know I'm so excited to have you here today. It's just, you know, sometimes you come across those products and you know what they can do and you can feel it. And now we get to share this with the world. So thank you so much for taking your time and being here with me today.
Absolutely. Absolutely. Thanks again.
You're welcome. So Mike, let's start first with you. Tell us a little bit about the backstory of MolecuLight. What's going on over there?
So sure. And again, my name is Michael Gleason. I am a regional sales manager for MolecuLight. And on behalf of MolecuLight, I wanted to thank you, Jonathan, for allowing us the opportunity to share the MolecuLight story and introduce this first-of-kind technology to your audience. MolecuLight is an FDA-approved device used in all aspects of wound care. Let me turn it on for you here so you can see what we're looking at here. MolecuLight is the world leader in handheld point-of-care fluorescence imaging for real-time detection of elevated loads of bacteria in wounds. So you probably ask, okay, so what does that mean? So in a minute, Ashley's going to go into greater detail about the MolecuLight, but in its simplest explanation, what we're doing is we're shining a safe violet light onto wounds, and we're looking to see what fluoresces back. And as one of our end users has said, and I'll quote him, he says, you cannot treat what you cannot see. So that's what we're excited to introduce to you, the MolecuLight technology and fluorescence imaging. So this technology was developed at the University of Toronto, Princess Margaret Cancer Center, by our CSO and founder, Dr. Ralph DaCosta. We are so happy to bring this, discuss this transformational technology to you. As everybody on this live stream knows, that as the population ages, wounds have become a national crisis, with over 6.5 million people suffering from wounds in the U.S. alone. So we know that the VA population, the patient population has been particularly vulnerable to wounds associated with diabetes, traumatic injuries, amputations, and surgical incisions, all of which can involve complex treatments that can last for months and potentially result in an extreme intervention. You know, what I like to say, Jonathan, is that, you know, proper wound care starts with a healthy wound bed. And we believe that using the MolecuLight, along with clinical signs and symptoms, can help guide clinicians to reach that objective.
Absolutely. And, you know, just some of our brief time talking, you know, what really is what matters here is the amount of time that you save with this device. And if you don't mind, Ashley, just tell us a little bit about the time-saving techniques there. What does this do from, you know, start to finish?
Well, I'll tell you a little bit about the MolecuLight. So the MolecuLight iX is a point-of-care imaging device, like Mike said, that does two things. So the first thing that it does, it uses a safe violet light to actually help clinicians detect elevated loads of bacteria in a wound in conjunction with clinical signs and symptoms. Now, when I say elevated loads of bacteria, I'm referring to greater than 10 to the 4th colony-forming units per gram or higher.
Outstanding. And as far back to this with the time saving, I mean, being able to take a picture and see, you know, the size of the wound, to track the wound all the way through and see the depth with this camera is just absolutely amazing. And, you know, I have to speak in layman's terms. Look, I know I'm no no doctor here. I'm not breaking into this, but I do know that from the doctors that I speak to and working with Mike and Ashley, I'm hearing how outstanding this product is and saving lives, saving limbs. And, I have to spread the word. That's my job at Maness Veteran Medical. And go ahead and add to that, Mike. What you think?
We love you saving the world there, Jonathan. That is beautiful.
And it's easily incorporated into your practice every day, whether you're inpatient, outpatient, long-term care, home health. I'll show you the procedure in a couple minutes.
Yeah, but go ahead. I'll let Ashley describe exactly the mechanisms of action around the MolecuLight.
Beautiful. Yeah, we're going to go ahead right now then and just let's hop right into the demo so everybody that's here can actually see what we're talking about.
Perfect. So I'm just going to bring this in a little bit so you can see me here. And I have a foot, and I'll actually perform the MolecuLight procedure so you can see exactly how it would incorporate into your workflow. So here's the device. You can see that there's a touch screen on the front, some power buttons on the top. We have some sensors here. This switch on the side actually will turn the violet light on, which I'll show you here. And we're going to use this in 2 steps when we do the MolecuLight procedure. So the first step that we're going to do is we're going to capture an image with the lights on. We'll perform our digital wound area measurement. And as you can see here on my wound, I've placed 2 stickers around the flattest surface around the wound. And I'm just going to go in and I'm actually going to get the wound in the center of my field of view and focus and capture the image. The second step then would be to go from this, not quite yet, Mike, to go from this image. I'm going to show you just so you can see. So this is what I end up with. And I'm just going to actually circle the wound here, and it's going to come back up with my measurement on the device. So I'll just show you what you end up with here. So you can see that this is actually pulling up a surface area measurement of the wound, greater than 95% accurate, up in the upper left-hand corner, your length, width, and then your depth stored on the right-hand side. The next step in our process is going to be to turn the lights out in the room, make it nice and dark. Go ahead. And then once I do that, I'm actually going to turn my violet light on once my sensor tells me that it's dark enough. And I'm just going to, again, capture an image under the violet light right here. And then that is the second part of the procedure. So what I have here on my device are going to be 2 images that are one is going to have the actual measurement information, and the other one is going to give us a wealth of information for the clinician to assess and to treat their plan of care. Can you hear him? Yep.
Everybody, so sorry about that. I made a mistake with the mic. But what I was saying there is with the MolecuLight device, you're able to track and document all the time, all the size of the wound, and save that time that used to take a lot longer to document this and put it out there. And now with the MolecuLight, you're able to save the time and store that data. And it helps the overall process of wound care, in my opinion. But so let's move along here real quick. Before MolecuLight, how did the doctors determine if there was a lot of bacteria in the wound?
So traditionally, Jonathan, the clinician would actually just use their clinical signs and symptoms to assess the wound to see if there was an elevated bacterial level. And the reason why these elevated bacterial levels actually can be harmful for the patient is that there's studies that show that they actually will delay wound healing. So when you have this real-time feedback and information, the clinician can then use it immediately to implement into their plan of care.
And do you have well, we've already saw this, but do you have any clinical images that you can share?
Absolutely. So I have a great example on my device that I will share with you. And it's one of a patient that had a diabetic foot ulcer. And I think a lot of the clinicians listening will identify with this, that we've all taken care of a diabetic foot ulcer. And this patient was in a total contact cast, properly offloaded for multiple weeks. I think it was about 3 weeks. And every single week, the wound was stalled and delayed. So that means it wasn't getting smaller from week to week. And so I'll just show the image here, you can see.
Oh, yeah.
And so the clinician had said that there were no clinical signs and symptoms for infection in this actual wound, but he did recognize that there was a little bit of macerated, which means moisture in the tissue. And so he's thinking, what am I going to do? So he performed the MolecuLight procedure, and this is what it showed. And so typically under this special violet light, tissue will fluoresce in a green range. And then there are two different colors that we see associated with those elevated loads of bacteria that we talk about. And one of those colors is red. And so I'll show you, I can get it here. This is what the fluorescence image looked like. And so you can see all around the outside of the wound, there's that bright red there. And that's been associated with elevated loads of bacteria that 10 to the 4th CFUs per gram or higher in conjunction with the clinical signs and symptoms. And so the clinician was able to use this data in real time without waiting for laboratory results to come back from a culture that could take often 2, 3, 4 days before they result. And he was able to act on a plan right then and there. And so I believe for this specific patient, they underwent some cleaning, some debridement, and then there was a specific antimicrobial topical dressing that was applied. And 2 weeks later, this is what the wound looked like whenever they actually took a look at the wound. Pull it up here, just so you can see this is what the wound looked like. It was 45% smaller in size. And here's the fluorescence image, just so you can see what it looks like. This wound doesn't have any of that red color that we were talking about that is associated with elevated bacterial loads. So it was on a much better track at that point.
Outstanding. I mean, and everybody can see this with their own eyes. I don't even need to say any words with this. The MolecuLight allows you to see deeper and see things that you can't see with your own eyes, that you used to have to swab and send off. And that's just my point that I'm getting out there. Mike, please elaborate a little bit more about, the whole process.
And again, that's really the gist of it. You just hit the nail on the head there, Jonathan. We know that, wound care can be a daily struggle to show improvement, especially when you're dealing with delayed or stalled wounds, that often associated with elevated levels of bacteria. So, when clinical signs and symptoms alone lack the sufficient accuracy to guide the decisions around bacteria, in wounds, this can be very frustrating, and we recognize that. So that's why, to help overcome this, we're hoping that you can help, create a habit by using the MolecuLight procedure along with your clinical signs and symptoms.
And we just did a recent study that showed about 15% of the wounds that were assessed by clinicians were not detected. Only 15% of those wounds that were assessed by clinical signs and symptoms alone to detect a heavy bacterial load. Only 15% of the time did they detect the loads of 10 to the 4th CFUs per gram or higher. So this really will help with that.
The other thing that I like to say around this, Jonathan, is this is more information than what you currently are working with on your clinical signs and symptoms alone. More information is always going to be good, especially when you're dealing with things that are, as I mentioned earlier, stalled or delayed, and you really have not been able to put your finger on that reason.
Yes, and look, what right now would be a good time for me to tell everybody, if you need any VA in the country, if you need a virtual demo, we are here for you. The email addresses are in the chat, but you can email me at the1legbandit at Maness Veteran Medical, or email Mike Gleason. His email's in the chat as well. We will get this set up. We are all here for you. I believe every VA in the country needs one of these units. It saves times. It helps the veterans, and I believe wholeheartedly in helping the veterans. So we've got to do this. If you have any questions, we stand by the product, and we're here for you. Okay.
So one last piece, though, Jonathan. I wanted to report that we do. I am happy to report that the MolecuLight procedure is being performed in the VA hospitals right now with great results. As a regional sales manager. We have regional sales managers throughout the country, as well as clinical specialists like Ashley, that we are ready to help in any way that we can to help you introduce this technology to your clinical practice, and hopefully, together we can help, maybe improve the quality of life on some of these patients that are suffering from these debilitating wounds. So please, again, thank you, Jonathan, for your help with this. And again, there is a link, and if we can be of any help, please let us know.
Oh, yeah. And so tell me, is there any other topics you would like to go over here? I mean, we've got all the time in the world, the platform. Is there anything else you'd like to hit?
Well, as Ashley indicated earlier, the things that we really like to focus on are the whole spectrum of wound care, from the cleaning, the original assessment, the cleaning, the potential debridement, the potential, for bacterial or microbial stewardship.
Right. I mean, definitely with dressing selection, there's all different types of ways that the MolecuLight has been assisting clinicians. And specifically, I think patient engagement. As a nurse, it's very important to me that when I'm working with my patients, they understand why we're doing what we're doing to them. And oftentimes I find that they don't understand why we're having them change their dressings, why we're having them clean their wounds, why we're having them undergo debridement and compression and things like that. And what's incredible to witness, Jonathan, when using the MolecuLight with patients, the clinicians know what we're looking for. It's easy for us to see certain colors and say, okay, red or cyan colors are associated with elevated bacterial loads. And so it's easy for patients to understand when I show them an image and say, this is an area, that we're concerned about. Then they become compliant in their care right there at the bedside. And it's incredible. And that to me is very special.
Well, this whole product is special. And when you come across a product like this, first of all, Maness Veteran Medical is blessed, and I've been, touting it out everywhere, but you have to speak about this product. Why? Because it's your baby and you know it, and it's your life. And I had to bring y'all out here to speak to everyone about it. So we have plenty of time. We've talked about the size of the MolecuLight, how easy it is to get around, the time saving in detection. Any more highlights that you would like to hit, Mike?
Yeah, I think we hit them all. But
actually, I was going to say you don't need any contrast or any kind of contrast dye or any type of patient contact to perform this procedure. So that's just something that sometimes people ask us. I think that that's important to know.
So, and you mentioned earlier, Jonathan, about the wound measurement. It is a great way to track the wound for visits. You are right now, in a lot of cases, people are relying on paper measurements. And paper measurements can be very subjective between users, between myself or Ashley. We may come up with different values, whereas the MolecuLight, utilizing the digital measurement accuracy of greater than 95% accuracy, really does help you track that wound between visits, because a lot of what is done with the wound is based on whether or not that wound is shrinking, or if it's stalled, or if it's getting larger.
Right. And if there is actually, if you don't have a standardization for your wound measurement, this provides that standardization. So that way you can in fact see if the wound is stalled from week to week. And maybe if there was a discrepancy from clinician to clinician, then you might not pick up on that.
I might get missed. But I appreciate it. I think we've hit all the sweet spots on it. We'd really love the opportunity to meet with the people on this call and demonstrate it in real time.
Outstanding. And we're definitely going to push this out to every VA. We have all the contacts. We're already selling to every VA in the country different products, but we're definitely going to get this out there. And, this truly is, and Mike can go into this, but this truly is a one of a kind type product. Correct, Mike?
It is. It is a first of kind. It's really the only handheld fluorescent imaging device used in wound care.
Yeah, and so that right there, it speaks volumes. So I just want to say thank you so much for being here with me and for the demonstration. Sorry again to my people. I got a little bit thrown off there with the mic, but look, it's all good. The whole point is the conversation and letting everyone know what's going on here with MolecuLight. And I know what we're going to do with this. I mean, we are going to get this out to every VA. I already have calls all the time with just the direct emails that I've sent out. But now that you can see the product, I know it's going to create the interest, and we're going to get to do a lot of demos. So thank you for your time, and I hope y'all have a wonderful day today. Okay.
Thank you so much, Jonathan. Take care.
Thank you. So look, everybody, that was outstanding. And I've been waiting for this for a long time. MolecuLight is near and dear to me. Again, I'm an amputee, and I know how fast wounds come up on you. One little sore here, and then it turns into something where I can't wear my leg for a week or two, and I'm down, and it just happens so fast. And products like MolecuLight, is going to be able to at least let the doctors know what's going on. Do I have an infection in there, a certain type of infection that needs a different type of treatment? And also, you know, if you have ulcers or any type of wound, they'll be able to track it, track the depth, and just know right away where you're sitting with that wound. And the veterans need that, you know, at the long-term care facilities, they need to know where they stand. And I believe the MolecuLight gives them the ability to know where they stand with their wound and just try to feel better about getting better. I know whenever people are sick, by talking with them at the VA hospital, whenever they're sick or they have something going on, a little bit of hope goes a long way, you know, and I believe that this product allows them to have a little bit of hope if they see their wound getting better, you know, or at least they know where they stand. And that's the real deal about the MolecuLight. So again, thank you to the wonderful team over there, Mike Gleason and Ashley. I really appreciate y'all for being here. And I appreciate all my partners for being here. We're all in this together. We're all in this mission together. And everything that I preach about, you know, getting together, making great partnerships, promoting your partners together and getting it out, it all goes to the greater good of getting better care to the veterans and to everybody out there. But I'm predominantly focused on the VA and the DOD. So, you know, we are able to do that here at Maness Veteran Medical. When we started, I knew what I needed to do because I was in the VA and I saw all the outdated products. There was not a lot of money 6 years ago. Now things are getting better. You don't have to wait 5 years to get cutting edge technology like this. All you got to do is pick up the phone and call me or email me, and I will get you what you need at any VA. I will do any paperwork, anything I've got to do to ensure that the product is there in your hands within a week or two. So, you know, we're very fast. We can flip the MolecuLights around in, you know, a week. You need it, let us know. We're set up. We can sell it. We're good to go. We've already done it, and we're going to take care of you. So to everyone else that is out there that is, if you may have a product that you think is game-changing, send it to me. Let me take a look at it. I'll let you know, from my expertise of being in the VAs and things, whether I can help you and push that product and get you where you need to be. But it's products like this that really make a difference, and MolecuLight makes a difference, and they are doing it, and they are, I'm letting you know, these are my words, okay? My words. This technology is saving lives and limbs and, just making people's lives better. So that's what I got to say about MolecuLight, and I'm just so proud that they chose Maness Veteran Medical to be their partner, and I will not let them down. We grind every day. My team is out every day talking about the MolecuLight, sending out the emails, and getting everybody interested. So when they need the demonstration, Mr. Gleason and Ashley is there to actually do a one-on-one demonstration to show you, not like they just did here. They did a broad little demonstration for me, and just to give you an idea, they will go into everything you need to know about the MolecuLight and spend whatever time that you need to ensure that this product fits you. And then we'll ensure we put the best package, the best everything together for you to get you the product right out the door and get it to you quickly and in a timely manner. So that's how we roll at Maness Veteran Medical, and that's how we roll at MolecuLight. So we are together on that. So again, anybody needing the demonstration, I need you to email me at the1legbandit at Maness Veteran Medical. I'll go ahead and throw that banner up real quick so you can see it. See here. There you go. So right there, the1legbandit at manessveteranmedical.com, or you can call the toll-free number 833-367-6778, and we will definitely get that set up. So for this week, I've got a couple more live streams lined up for different partners. I'm also expecting a live stream with Braze Mobility next week, which is outstanding. You've really got to check this out. If you've never seen Braze Mobility, they're accessories that goes on wheelchairs that helps people who are wheelchair bound not roll over, not run into things, not scrape their legs and create wounds and things of that matter, or fall over backwards. You got to check out Braze Mobility. Miss Pooja, what she is doing is outstanding. She grinds every day. She has the same work ethic as Maness Veteran Medical. She's always trying to improve the product and get her product out there. So I'm expecting to do a live stream with her. And I have a lot of things to do with the BPAs that Maness Veteran Medical have going on right now. So I am busy, but I am going to schedule these because I believe product knowledge for anybody that will listen, all my nurses, all my VA procurement officers, that's on my LinkedIn, is just so important. Most of the time when I'm having a conversation with the procurement officers, they don't even know that things exist. Like, it doesn't matter how many emails or whatever you put out, you have to show people that things exist, or they just kind of scroll past it. You know how when you're scrolling through your feed, maybe sitting around looking at LinkedIn, you know, you'll scroll past something, but what Maness Veteran Medical does is it shines a spotlight. And if you ever go to Maness Veteran Medical, you'll see up at the top, there's a thing that says spotlight. And I put it in my chat here, the spotlight for MolecuLight. But I have spotlights for a lot of other products on there that you may have not seen before that you need to know about. Like another product partner of mine, I need to go and share this with you. It's called MindTech. What this does, if you know anyone who's ever had a stroke or had a traumatic brain injury and has lost mobility, this MindTech actually can help stimulate the nerves and train your body, your upper body, to move again. So at least if you have a stroke, you can build some muscles back up and brush your teeth and feed yourself. And you would not believe, you want to talk about taking a little positive and turning it into a big gain. Whenever somebody's had a stroke or a brain injury, when you get where you can't do anything for yourself, when you can start moving your right hand and your left hand and doing things even with your hands, it's a huge, huge win. You know, it motivates you. It pushes you in the right way. It gives you the drive to continue pushing forward. So we have that product as a partner. We are already, you know, setting up demos for the VA for that, and working on things with MindTech. But we're so blessed to have products like this. And I'm going to continue going through all these outstanding products with this series, the Partner Talk. I know that it's having great success. If you looked at my YouTube, we've went up over 1,000 views in certain ones. My subscribership is going up. And I'm just so thankful for everybody taking the time and looking at these videos that we're putting out, because it's really about one thing. Again, it's about changing the world, making sure people have better care. So if you know, whatever happens, Maness Veteran Medical is meeting its mission and making that happen. So I've been with you for 25 minutes, a pretty quick stream, but we got to the point. We said what we needed to say. I just want to say thank you again, and I look forward to speaking to you later, and hope y'all have a wonderful day. Thank you very much.